Check for patient's limitation. Keep in mind that identifying limitations prevents patient discomfort and injury. After that, we're going to perform the hand washing, also known as the hand hygiene. We do this procedure to ensure the safety of the patient and also the nurse, and to prevent the cross-contamination of microorganisms. Then bring the necessary materials to the bedside. The rationale for this is to conserve time and save energy. Greet and identify a patient. In identifying a patient, we may ask him or her to state her full name, birth date, and also for unconscious patient, we may check their ID tag. Explain the procedure. We do this so that the client is aware what we're going to do with her. Provide privacy for the patient. Next is adjust the bed so that you don't develop back strain. After adjusting the bed, we can now perform hand hygiene and also then gloving. So we do this procedure to prevent the cross-contaminations of microorganisms between the nurse and the patient. After gloving, make sure that the side rails of the patient is up. For example, if you're in left, make sure the right side is up because it prevents the falling of a patient. We can now proceed with the procedure. Ask the patient if the temperature of water is good enough. Since I already fold the washcloth like a mitt on my hand and lay a towel on patient's chest and tap bath blanket, I will now proceed to wipe the eye of the patient using a clean wet towel only. As you can see, I started from inner part of the eye to outer part near the nose. I didn't use soap because it can be irritating to the eye and we wouldn't like to irritate the patient's eye. And make sure to bathe patient face, neck, and ears using appropriate emollients to maintain skin integrity. Right after that, expose the patient arm and place towel lengthwise under it. Using firm stroke, wash hand, arm, and axilla. The reason is that the towel keeps the bed dry and eliminates contaminating the clean area once it is washed. Apply a lotion on a patient's hands if only she wants to. It will keep the patient's hands moisturized. We're going to put back the clothes of the patient now. The reason for this is to provide privacy for the patient private area. Then position the patient on a comfortable position. After positioning the patient on a comfortable position, we can now throw the soiled linen. We can now dispose the dirty water and clean the basin using warm water and soap, and dry it using a towel or paper towel, and perform hand hygiene. We will now fill the basin a clean water for shampooing the patient. Since I already identified the patient, prepared the materials, and explained the procedure to her, I will now proceed to hand hygiene and gloving. Right after that, I will put a towel under her back, under her head, and on top of her chest so that the linen under it will not be wet with water, and proceed on soaking her hair with clean water and putting shampoo, then check for her head and massage. After washing the patient's hair, I will now rinse it using a clean water and let it dry using a towel. After drying her hair, I will now remove the soaked and soiled towel and position the client on a comfortable position. We can now dispose the dirty water and clean the basin using warm water and soap, and dry it using a towel or paper towel, and perform hand hygiene. I will now proceed to providing oral care for the patient. I already do hand hygiene and now I will put a towel on a patient's chest to prevent her from getting wet. I am preparing her toothbrush by just putting a toothpaste on it and brush her teeth till I cover all the sides. And let her gargle a clean water so all the toothpaste will be removed from her teeth and mouth. Lastly, I will position the client on a comfortable position and perform hand hygiene. Since my hands now are clean, I will now proceed to giving back massage. I already positioned my client in a comfortable massage position, so I will clean her back and massage it. After putting her in a comfortable position, I will now remove my gloves and perform hand hygiene. That's all for today. Again, this is your student nurse Althea Castillo Sangalang from BSN 1Y3M4B at Our Lady of Fatima University. Hope you learned something about bed bath, oral care, shampooing, and back massage of a patient. Hi everyone, I am Althea Sangalang from BSN 1Y3M4B, and today I'll be doing the demonstration of transferring patient from chair to bed and bed to chair. So why we do this procedure? We do this procedure to help those patient that is incapable of moving. Review patient medical records. We do this procedure so that we determine the limitations of a patient. Then perform hand hygiene, also known as hand washing. We do this procedure to prevent the cross-contamination of microorganisms between the nurse and the patient. After that, we can now proceed to identifying the patient. In identifying a patient, we must ask them for their full name, birth date, and also for unconscious patient, we may check their IV tag so that we know that we are helping the right patient. Then provide privacy by just closing the door or the curtain. And adjust the bed on elbows height so that we prevent back strain. So I'll start by transferring the patient from chair to bed. As you can see, I instruct the patient to hold to me while I carry her. The reason for this is that so she won't fall and prevent any injuries. Then remove the patient shoes. After that, assist the patient head and also her legs when laying down. And now I will transfer the patient from bed to chair. As you can see here, after removing the patient's comforter, I positioned her on a side position before asking her to hold to me. The reason for this is that so it will be easy and safe. Then after that, I asked her if her knee are hurting. If not, proceed to transferring her from bed to chair. Hi everyone, I am Althea Castillo Sanggalang from BSN 1Y3M4B, and today I'll be doing the return demonstration of providing hot and cold compress to a patient. I'll start by performing hand hygiene, also known as hand washing. Then, greet and identify the patient. We do this procedure so that we won't give care to the wrong patient. In doing this, we can ask for their full name and birth date. After that, we can now proceed to providing privacy. In providing privacy, we can just close the door or curtains and prepare the materials. After that, we can do hand hygiene and gloving. And we can now proceed to providing hot and cold compress to a patient. Make sure that when providing hot and cold compress, you will check for the monitoring or reaction of the skin of the patient. A hot compress is a method of applying heat to the body to help relieve pain and muscle stiffness, improve blood flow, and promote relaxation. It can be used for various conditions like muscle ache, joint pain, eye infection, and even menstrual cramps, while the cold compress is used in acute injuries with swelling, inflammation, and pain, particularly within the first to 48 72 hours after an injury. They work by constricting blood vessels, reducing blood flow to the area, which help to minimize swelling, inflammation, and pain. After positioning the client in a comfortable position, I will now perform hand washing, also known as the hand hygiene, to prevent the contamination or the cross-contamination of microorganisms between the patient and the client. After hand washing, make sure to document the findings.